Well, let's get all the information on that with Dr. Philippe Duneton, who joins us from Geneva. He's the Executive Director at the International Health Agency, Unitaid. Philippe, great pleasure to have you with us on the program today. It's the first time, I think, that a lot of our viewers will be hearing about lenacapavir. Tell us more about what this preventive drug is and the cheaper versions that are set to enter the market.
Thank you, Jenny. Thank you for having me. I think it's really an historic time. It's the first time that we have a medicine that can prevent HIV among the women. We call it PrEP, prevention of HIV. So we have been working for a lot of time on oral PrEP. So it's the medicine that you can take by the mouth, but every day. But in this case, is 2 injections a year, 1 injection every 6 months, and which, as you said, 100% efficient to prevent HIV. And one important point is that it was very difficult to have a tool that works for women and young girls in Africa that represent quite an important part of the epidemic of HIV, and this is working for them. It's the first tool to prevent HIV among women in Africa. That's why it's so important.
So the drug is used to protect people from catching the virus, but can it also be used to treat those who already have it?
Yes, it will be a second step. So we are working on different type of medicines, but lenacapavir can be one of them. And just to highlight the price that we negotiate with Dr. Reddy, with the Clinton Foundation, $40 represent the same price as the treatment, 1 pill a day, is also the price for the prevention, oral prevention. So that's why we were shooting for $40, and we hope that people will have access to this drug, let's say in 6 months instead of 1 year. So we want to have also the speed in terms of access.
And Philippe, how can we expect this rollout to be carried out, and how accessible will it be to people who can benefit the most from them? Because some experts have estimated that around 40 million people would need to take preventive drugs in sub-Saharan Africa, for example. There's obviously, huge preparation needed for rapid introduction and scale.
Yes. So this is the challenge. So one piece of it is the price, because if it's too expensive, there is no way that people will get it because it will be too expensive. $40 is the right price, even if we can maybe think that we will have a better price in the coming years. But what is important is really to shape the program, to reach out the people, in particular women, who can have access to that. So that's the kind of work that we will do as Unitaid, but with our partner, CHAI, Global Fund, PEPFAR, and countries, to make sure that we can have the program who support access for, in particular, young girls and women.
Speaking of young girls and women, are there concerns regarding safety or privacy and even stigma that could create obstacles in the rollout and implementation, especially for women in low-income countries?
Yes, that's the challenge. And that's why it has been very difficult for oral PrEP, because you have to carry on a lot of pills. And of course, there is this question about stigma. That's why in terms of clinical efficacy, it works, but also in social efficacy in a way. The fact that it's very discreet, so you have a shot, nobody knows, you have 2 shots a year. This is much more easier for many of young girls and women. So that's also the advantage, and that's why it's a breakthrough also in terms of accessibility of this lenacapavir.
Now, the new deals don't include some middle and high-income countries, including, Brazil, that together account for around 20% of new infections. What is the reason for this, and is that something that could change in the future?
We hope to make progress in that, but The first agreement was under the license that Gilead has given for 6 generic manufacturers. So they define the scope of countries. And they have made the decision not to include some countries like Brazil. We know that there are ongoing discussions between Brazil and Gilead. Gilead is the one who invented lenacapavir. So we hope that they can find a solution, or we can also look if the deal we have for the generic version can be in a way or another part of the discussion with Brazil and Gilead. So we hope that, yes, also in this country, like Brazil, this will be affordable.
So fortunately, lenacapavir has been spared from US President Donald Trump's foreign aid blitz, so to speak. But can you tell us more about the state of funding to some other urgent health priorities like malaria and tuberculosis, for instance?
So as you mentioned, there is a global challenge in terms of financing the what we call global health, in particular HIV, TB, and malaria. Some part of PEPFAR against HIV/AIDS in the US have been reinstated, and we are working with them, in particular in access to lenacapavir among women, in particular pregnant women. It is less clear for malaria and TB. I think that there will be discussion also at the Congress. So again, we have been working closely with Europeans, France, UK, and others, Japan, Korea, and we hope to see the move in the US. So we are, anyway, not waiting for anybody, and try to do the best with what we have and support, in particular, African countries to fight HIV, TB, and malaria.
All right, Dr. Philippe Duneton, it's great to speak to you. Thank you so much for your time today.